do I see myself doing this job, even though I might not see somebody like me, quote unquote. When I was looking into my majors in high school, I think a lot of the people that I saw on these nursing websites and stuff were all majoritively female, and many of the males that I saw were very far and few to find. Going into college, I decided that nursing more fit my style, and so I spent the first year or so kind of deciding if nursing was right for me, and I finally went on clinical on my labor and delivery unit at Beth Israel, and I saw a C-section. I thought it was an amazing experience. On co-op, I was the first male co-op they've had on the unit. They hired their first male nurse in 2020, so less than 5 years ago. It was literally 3 years ago, which is kind of crazy. But honestly, I think at the end of the day, almost all the nurses were super accepting, and they just were happy just to have another hand to help them out.
I think the most recent statistic was about 13% of nurses are men, and we know about 50% of the population is men. So our goal should be to have our workforce be representative of the populations we serve. And as we do that, there have been studies that show there are improved health outcomes at individual levels when people are in an environment where there are health professionals that look like them, who come from similar backgrounds, etc.
I identify as a Black or African American person. I also identify as a gender non-binary person. I think those two identities are both unique, and they also come together and help me care for patients with a variety of different identities on their own. I'm really passionate about caring for diverse patients and making them feel included and using inclusive language in the hospital setting. And I think my identities just help me with my own lived experience, and I'm able to bring that to when I care for patients.
Well, what we really need in the nursing field is more undergraduates of color and different ethnic and racial backgrounds, because we have a predominantly white workforce in nursing, and that's not reflective of our population. People want to see that someone taking care of them that's like them.
I hope to see the nursing field grow and expand with a variety of diverse individuals caring for patients at the bedside. What I think is really important is that caregivers match the population that they're treating, and we have such a diverse population with not only racial identities, ethnic identities, sexual orientation and gender identity. So I think it's super awesome when providers and nurses can connect with their patients on the level of, we share this identity, I know what you're going through.